Hi, how are you?
Good. How are you doing?
I'm good, thanks for asking. So I wanted to stop by real quick and talk to you about Brayden, a student you will have in your class next year.
Okay.
So, as you know, Brayden had moderate to severe hearing loss, which resulted in him having bilateral cochlear implants installed, meaning he has a cochlear implant in each ear. Are you familiar with cochlear implants?
No, not really.
So, cochlear implant is a device that's inserted into the ear and it replaces the function of the inner ear, which helps Brandon hear more normally.
Okay, that makes more sense.
Yep. So since Brandon previously was able to hear, he may have a little bit of difficulty with this cochlear implant because sounds will be portrayed as more robotic than normal. Um, so it may be difficult for him to distinguish and identify and discriminate sounds. But he will get used to this, and hopefully this won't be a problem by the time he gets into your classroom.
Okay. Is he able to hear normally?
Yes and no. So pure tones he will be able to hear normally, meaning that when he gets his hearing tested and he has his headphones on and they're putting in sounds into the headphones and he's identifying whether he hears them or not, um, with a hearing screening like that, he will hear normally. He will test that he has normal hearing, but he will still have difficulty just distinguishing certain sounds and identifying sounds. Um, which will make it harder for him to comprehend speech.
Okay.
So I wanted to stop by and offer you a few suggestions and modifications that you could help with Brandon when he's in your classroom to help him to um, succeed in the classroom as best as possible.
Okay.
So I think it'll be important for you to first do a Ling 6 test on him when he comes to the classroom each day or each day, period throughout the day, however often he's in your classroom. This sounds intimidating, but it's very simple. So when he walks into the classroom, you will perform the Ling 6, which is the 6 sounds that you will say to him at a normal volume, and you'll test one ear and then you'll test the other since he has 2 cochlear implants. So you'll do the 6 sounds, o, ah, e, sh, and s. And you'll say those one by one, and he will identify if he's able to hear you or not. And this will test to make sure that his devices are working properly and that he's able to hear the sounds needed in order to understand speech. If for some reason he's not able to hear, you can send him down to my office and we can troubleshoot the problem. And then I will give you some handouts about the Ling 6 test just so you have more information and you feel more comfortable, but it is super simple. But also, I think it'll be important for Brandon to be provided preferential seating in the classroom, so it'll be important for him to be in the front of the classroom so he's able to hear clearly at an appropriate volume. He will be able to see your mouth move, your facial expressions, and that will just help him comprehend what you're trying to say in the classroom. When you're having classroom discussions, the students should speak one at a time just so there's not a lot of competing noise. And then, of course, it'll be important to make sure that there's decreased background noise just to help Brandon be able to focus on the sounds in order to comprehend. And then everyone should be quiet as a speaker is speaking and when you're speaking directly to Brandon, speak just with clear, simple sentences so it'll be easiest for him to understand. And then it'll be very important to provide him with visuals for him to have that added support. So visuals could be a schedule of what you are doing throughout the day or doing during that period, written directions, written expectations, pictures of what he should be doing, and this will just give him a lot of added support to help him comprehend what he should be doing. And then also, it'll be important for him to be given an assistive listening device. And this will just help him to hear more clearly with his cochlear implant. It'll help separate the sound he needs to hear versus background noise, as well as amplify it to an appropriate volume. Are you familiar with assistive listening devices?
No, I'm not.
Well, I think that out of all the different options, an FM system will be most appropriate for him. So this will be a microphone that you will wear and you will speak directly into it and you will have the transmitter. And then Brandon will have the receiver. So he will be able to hear directly what you're saying into your microphone. So this helps to cut out all the background noise of the classroom. He can focus directly on what you're saying. It'll help him to identify and discriminate the speech sounds that you are saying in order for him to more clearly comprehend the message that you are saying, as well as he could amplify your volume to whatever is most comfortable for him.
Okay.
Well, I won't keep you any longer, but I just wanted to give you that information, and if you need anything, just stop by my office.
Okay, thank you.
Thanks.